Hello, and welcome to the APhA-ASP Women's Health Campaign Outstanding Chapter presentations. I will now turn it over to the chapter leaders at the University of Houston College of Pharmacy.
My name is Casey Rathburn, and I am the immediate past president of the University of Houston College of Pharmacy APhA-ASP chapter. We are honored to be chosen as one of the top women's health initiatives and to be presenting about our work today. First, we would like to thank our supporter, Mirth. This couldn't happen without you. Today, we are going to discuss the variety of events and topics our chapter covered, how we collaborated with our current patient care project, and what our future plans are for our women's health initiative. We tried to create a comprehensive women's health program for our chapter and college since we had never had one before. We collaborated with community partners, school organizations, faculty, and within our chapter to promote many different aspects of women's health, including HPV awareness, cancer, reproductive health, and more. Our chapter focused on 4 components when planning our women's health event: student pharmacist development, community outreach, social media, and health fairs. For student pharmacist development, we hosted 3 seminars. The first was the Silk Rose Jubilee that we co-hosted with our college's Kappa Epsilon chapter. During the seminar, 2 survivors discussed their journey to remission and the impact their pharmacists have. Both expressed how their pharmacists caught many drug interactions with all of their medications and helped with medication changes due to adverse reaction. The goal of this event was to show student pharmacists the patient side of breast cancer and provide an opportunity to gain empathy for future patients. Another event we co-hosted with KE was TLNT. During this seminar, an oncology clinical pharmacist came to educate students on ovarian cancer. All students who attended the seminar received a complimentary teal mug and teal ribbon lapel pin to wear on their white coat and promote ovarian cancer awareness even further. Lastly, we hosted a women's health seminar that Callie will discuss later in the presentation. For community outreach, we hosted tables at the University Student Center and in the College of Pharmacy to give away free awareness ribbons and education cards about different subjects. We partnered with local organizations like Peach Outreach, who gave us free materials about endometrial cancer to hand out. We also volunteered with the Cottage Shop, which is a local organization that supports a women's shelter. Lastly, we hosted a pink lemonade stand where we sold lemonade, baked goods, and lapel pins for $1. We donated all of the proceeds to the Rose of Houston, who provides free screenings and procedures to women in the Houston area. Through social media, we impacted over 82,000 people through various platforms. We tried to highlight important National Women's Health Days by posting pictures like the human pink ribbon picture you see on the slide, or awareness infographics. We also partnered with our university's radio station and wrote newspaper articles to raise breast cancer awareness during October. Now I'm going to turn it over to Callie to discuss how we collaborated with our other patient care projects.
My name is Callie Downs, and I am the immediate past Vice President of Patient Care. Our chapter did not have a standalone women's health initiative, so we decided to integrate women's health projects into existing initiatives for our first year. We started with 2 basic questions. What projects are we already doing, and how can we incorporate women's health? Operation Immunization had clear ties to the Women's Health Initiative. One of our first events of the year was Mayor's Back to School Fest. This is an annual event held in downtown Houston where thousands of students and parents from all over the city come to get school supplies and kick off the school year. Our chapter collaborated with Blue Cross Blue Shield Caravan to review vaccination records and recommend vaccines for kids headed back to school. Student pharmacists screened hundreds of kids. It is important to include HPV vaccine screening in all vaccine reviews and to get the conversation started early with parents regarding the benefits of the HPV vaccine. Additionally, Operation Immunization collaborated with Randall's Pharmacy, a local grocery chain, to provide bone density screenings at their flu clinic to promote the importance of bone health. Our Women's Health Seminar was a collaboration between Operation Over-the-Counter Medicine Safety and Operation Diabetes. The seminar was designed to further develop student pharmacist knowledge in women's health topics that are not commonly discussed in depth by our curriculum. Operation OTC Medicine Safety invited a local community pharmacist to discuss OTC use in pregnancy and breastfeeding, common questions received in practice, and share resources to find more information on these topics. One of our professors and faculty advisor worked with Operation Diabetes to talk about gestational diabetes diagnosis, complications, and treatments. Next, Operation Heart hosted a health fair at a women's conference where student pharmacists provided blood pressure screenings and were able to promote the importance of women's cardiovascular health. Generation RX joined the Women's Health Initiative by volunteering at a local center for women battling substance use disorders. The Women's Center operates the Cottage Shop, a resale shop benefiting the Women's Center and where student pharmacists volunteered to help organize donations and assist in operations. IPSF hosted multiple events to promote reproductive health. Beyond their HIV seminar for student pharmacists, IPSF handed out free HIV testing information and condoms at our university student center. They also volunteered at the annual Holmes Clinic Health Fair. Holmes Clinic is a completely student-run organization that operates in downtown Houston for homeless patients. Students from all different disciplines attended the fair, including medical, pharmacy, optometry, and dental hygiene. Student pharmacists provided medication reviews, patient education on HIV and safe sex practices, and handed out free condoms. By integrating women's health into existing patient care projects, we were able to build a strong foundation for our chapter moving forward with this initiative. I will now turn it over to Taylor to talk about what they are currently doing.
Hi, my name is Taylor, and I'm the current Vice President of Patient Care. After the huge success we had in integrating the Women's Health campaign into existing operations, this year we decided to create a separate operation for women's health. We put a heavy emphasis on collaboration with other operations to ensure we continued events from last year, as well as creating new events and educational material. One of our continuing events was the Women's Health Seminar. We had a guest speaker Skype in and talk about her role as a pharmacist and her impact on keeping women healthy in the community. Topics included pregnancy, birth control, and the importance of regular screenings. We also continued volunteering with Blue Cross Blue Shield Caravan at the Mayor's Back to School Fest to educate parents and kids on the importance of the HPV vaccine. In addition to this activity, we created an interactive game for kids called the Hygiene Game. It is designed specifically for kids to help them learn and reinforce how important it is to take care of themselves and have good hygiene. There are basic questions and answers to good hygiene habits. We ask the kids questions and let them answer. If they have trouble answering the questions, that is a good opportunity to have an educational conversation about good hygiene and why it is important. The ultimate goal is to engage kids on how to keep themselves clean, happy, and healthy. This game was also utilized at the Houston Children's Museum at an event we call Pharmacy Fridays, where student pharmacists visited the local children's museum to educate and play pharmacy-related games with kids. We also created another game in collaboration with Operation Heart called Spin the Wheel Women's Health Heart Game. We have a variety of true-false questions where patients spin the wheel to get a question. If they answer correctly, we give them prizes such as stress balls shaped like hearts. Additionally, we created an HPV educational poster in collaboration with Operation Immunization that we could take to health fairs and use to provide patient education. Now we will hear from our current Women's Health Chairs, Chelsea, and Erin.
My name is Chelsea McLean, and I am one of the current Women's Health Initiative chairs. This year, we wanted to expand our mental health and body positivity outreach for women. One of our future goals is collaborating closely with Operation Self-Care to start an annual National Eating Disorder Association, also known as NEDA, campaign week. The NEDA campaign will include several social media posts, tabling in the University of Houston Student Center to raise awareness, as well as participating and volunteering in the local NEDA walk. New events created in collaboration with IPSF this year include the United Against Human Trafficking seminar, as well as the Ride for a Reason spin class. The United Against Human Trafficking seminar was a unique chance to learn about health professionals' role in noticing the signs and offering assistance to those trapped in the human trafficking network. The Ride for a Reason event was a way to get the community involved in raising awareness, and all proceeds from the spin class benefited the United Against Human Trafficking organization.
My name is Erin Anderson, and I am the other current Women's Health Initiative chair. Another one of our goals this year was to utilize more resources available to us for women's health, so we reached out to the Women's Clinic at the University of Houston. We planned an event where pharmacy students will give STD education utilizing our HPV poster, while a women's clinic representative will also educate and distribute free condoms to students. Free information about what services the on-campus clinic has will also be provided. We also wanted to expand our social media presence by creating content like our breast cancer awareness post, as well as educational infographics about various women's health topics like heart disease and birth defect prevention. Looking forward, we hope to keep our momentum of growth utilizing our current ideas and collaborations and new ones in the future. Thank you for listening. If you have any questions, please feel free to reach out to us.
This concludes the presentation. Thank you very much for joining.